Hi, my name is Jade Old, and I'm here to talk to you today about the drug Velban, also called vinblastine. So what is Velban? Velban is a cytotoxic chemotherapy drug, also known as an anti-cancer drug. This drug is cell-specific, meaning that it affects cells which are in the dividing phase. It is also a vinca alkaloid under the plant alkaloids. So this drug is actually derived from the periwinkle plant, and that is a picture of it. It is from Madagascar, and it can also be found around here today if you pick it up from a local floral shop. So what is Velban actually used for? It can be used for Hodgkin's disease, which is a cancer that starts in the white blood cells. It can also be used for non-Hodgkin's lymphoma, which is a cancer that starts in the lymphocytes. It can also be used for testicular, breast, lung, head and neck, and bladder cancers. It can also be used for Kaposi sarcoma, which is a cancer that starts from the cells that line the lymph vessels or the blood vessels. It can also be used for mycosis fungoides, which is when T cells become cancerous and they can actually cause skin lesions. It can also be used for choriocarcinoma, which is a cancer that occurs in a woman's uterus. And it can also be used for histiocytosis. This is when histiocytes move into tissues where they don't belong, and they can cause extensive damage. They can also bunch together and cause tumors. And finally, it can be used for ITP, which is idiopathic thrombocytopenia purpura, which is a bleeding disorder that occurs due to low platelets. So, routes of administration for this drug. This drug is actually only given through IV. There's absolutely no oral forms available for this drug. It can be given IV push or IV infusion. If it is given through IV push, it needs to be given over 1 minute. This drug is usually given once every 7 days. And this drug is actually known as a vesicant drug, which is this drug needs to stay in the veins in order to be effective. If it were to escape the veins and go into the surrounding tissues, it can actually cause very extensive damage and also blistering. So it is important to keep in mind that nurses and doctors who are administering this drug need to be carefully trained in doing so. There are some adverse reactions that follow this drug, just like any drug. There's common and you have rare. Some common adverse reactions include low blood counts, which are white blood cells, red blood cells, and platelets. You can also have injection site reactions, fatigue, and weakness. Some rare adverse reactions include nausea and vomiting, poor appetite, peripheral neuropathy, temporary hair loss, mouth sores, taste changes, and people actually report having a metallic type taste in their mouth after taking this drug. More adverse reactions include jaw pain, hypertension, and muscle and joint pain. So some things to keep in mind while being on this drug is that you should not receive any immunizations or vaccinations without your doctor's approval. And you should also avoid people who are sick or have just received a live vaccine. This is because Velban actually suppresses your immune system. So coming in contact with someone who is sick or has just received a vaccination, your body won't be able to fight off whatever infection is going to get in there. This drug is also a pregnancy category D drug, meaning that it can potentially cause harm to the fetus. So if you are pregnant, planning on becoming pregnant, or breastfeeding, you should not take Velban. There are some lab tests that are going to be monitored while being on Velban. This is the complete blood count. The complete blood count is monitored to see how well the drug is working, and also to monitor for adverse reactions. Like I said before, a common adverse reaction is low blood count, so white blood cells, red blood cells, platelets. So if it shows up in your CBC that your white blood cells are low, we might consider this as an adverse reaction, and this is when benefits need to outweigh the risks to see if you should still be on this drug or not. Okay, and that's all I have for you today. These are my references and where I got all my information from. Thank you.